Hello, my dear friend. A very warm welcome to all of you in this NEET PG 2022 PSM Recall session. My name is Dr. Ashwani Ranjan and I have done my MBBS from Aligarh Muslim University, my MD in PSM from AIMS New Delhi. So in this session, the first question which we are going to discuss is about WHO stepwise surveillance approach. So this surveillance is something which is done under our national NPCDCS program. Of course, it includes 4 diseases: CVD, diabetes, cancer and stroke. And in this surveillance, we look for 3 factors. This is a page from the eGurukul notes itself, class notes, that there is 3 things which we evaluate. First is we look for the physiological factors, then we look for physical factor, and then we look for biological factor. And we look it at 5,000 population in all different countries so that we can compare it between countries, that how many people are at the risk of developing non-communicable disease in India, let's say, as compared to at the risk of developing NCD in Uganda. So to compare any 2 countries on the basis of risk of NCD, first we ask physiological factors. Now, physiological factors can also be called as behavioral risk factors, because here we are asking about, do you smoke, do you drink, do you take salad and green vegetable in your diets and all those things. So smoking, drinking, all of these things are the behavioral risk factors which we ask first. And these behavioral risk factor, of course, they are dealt with psychology. So we can call it psychological factors. This is the first thing. Second thing we ask is physical factor like BMI, BP and age. And third is biological factor, in which we can do random blood sugar. And in developed country, here we also do thyroid profile and lipid profile. Okay, thyroid and lipid profile is also done. Plus, in some country, they also measure sodium and creatinine level to rule out any renal disease. So the question was that which of the following is not a part of WHO stepwise surveillance? As I said, the first is the psychological measurement, and in that psychological we have the behavioral management. The second step was the physical measurement, where we were measuring the BMI and BP of the patient. But we do not do any therapeutic measurement. We measure random blood sugar, but that is measured as a screening test part and it's not for the therapeutic part. So out of these 4 options, if these are the 4 options in the exam, therapeutic option should be ruled out, because we are asking about the behavior, psychological and physical factors. Now coming on to the next question. The next question was about this new thing, seed and manure. Who fund this seed and manure in applied nutrition program? So what is applied nutrition program? It was started in Odisha first in 1973, and then after applying it in Tamil Nadu and other part in 1983, this program was implemented all over India. And under this program, we are giving education and we are funding the growth of green leafy vegetable, and we are also trying to promote pregnant women to increase intake of vegetable and fruit. So who gives seed and manure in this program? There are 3 organizations which fund this program. One is UNICEF, one is WHO, and the third is Food and Agricultural Organization, FAO, whose headquarters is in Rome, Italy. So Food and Agricultural Organization, if it was not in the option, then the second best answer will be UNICEF. Why UNICEF will be the answer for that? Because one thing is, it is written in the applied nutrition program guideline that UNICEF fund it. Second way to find the answer is, we all know that in UNICEF the key strategy is GOBI-FFF. So out of that, one is about food fortification, and UNICEF does focus on that. And along with that, UNICEF also have this separate program for nutrition of the children. So UNICEF is the one, along with Food and Agricultural Organization, which fund this seed and manure in applied nutrition program. So please do let me know whether these options in the recall are right or not. Okay. So if these are the option, out of these four, the best will be UNICEF. Now, coming on to the next question. The next question is from urban CHC population norm. So we read about urban CHC in our national urban national urban health mission. And in this national urban health mission, you can see one thing is we don't have ASA, we have USHA at 2,500. Then they report to urban A&M, there is no urban sub-center. Then there is urban PHC, which is at 50,000 population. And we have urban CHC at 2.5 lakh population. So one thing is urban CHC is at 2.5, not at 1 or 1.5. So that option is ruled out. One other option was that under one urban CHC, how many PHC were there? So you can see urban CHC is at 2.5 lakh, PHC is at 50,000. So that means under one urban CHC, there will be roughly 5 to 6 urban PHC. And this is written in the PARC also, that one urban CHC look over 5 to 6 urban PHC. And of course, this urban CHC we have is at 2.5 lakh and urban PHC is at 50,000 population. Now, how many beds are there in urban CHC? So, in the PARC it is written that for urban CHC, the number of beds are 30 to 50 bed. But in metropolitan area, they have written this word separately, that in metropolitan area, like all the 4 metropolitan cities of India, one urban CHC will be at 100 bed. So urban CHC will be at 100 bed in metropolitan area and 30 to 50 in other cities where this is applied. So now in metropolitan area, this is at 100 beds. So now let's look at the options which were there. First was, which is true they are asking. So the first option is minimum 100 bed in metropolitan area. This is a right statement. Referral center for 2 to 3 PHC, this is wrong. If they said in place of 2 to 3, 5 to 6 PHC, then it will be right. Then they say no district or sub-district hospital should be located in that area. No. It is written in the PARC that if there is any district or sub-district hospital in that area, urban CHC should be in addition to that district hospital. It's not that if there is district hospital, there cannot be urban CHC. Okay, this is in addition to that. So this is wrong. And it is not per 1 to 1.5 lakh. It is at 2.5 lakh population. Okay, so the correct answer is 1, minimum 100 bed in metropolitan area. Now coming on to the next question. Broken vaccine vial will be thrown in which category? So I think this is something which is very simple to answer, because we all know that all the glasses, metallic implant and metallic instrument goes in blue category. Only one exception is that if the glasses are contaminated with some cytotoxic waste, then it goes in yellow category and collected in a separate wooden box. But there should be cytotoxic drug in that glass ampule. And vaccine is not a cytotoxic drug. So if they ask this question, broken vaccine vial or glasses ampule, simply either of any of these two questions had came. And out of that, no matter which question is there, the answer will always be blue. Broken vaccine vial will also go in blue and glass vial will also go in blue. Okay. And blue we collect in cardboard boxes. So it's in the cardboard boxes, blue category is collected, and of course vaccine vials goes there. We have discussed it in the classes also that glasses, metallic implant and instrument will go in blue category. Of course, in white, remember, many of us get confused. We think metallic sharp instrument go in white. No, in white, you can simply read about 3 things only. 3 things goes in white. One is all the surgical blade. Second is all the needles. Third is all the suture. So if they ask that there is a syringe with fixed needle on it, syringe with fixed needle, where will you throw it? Answer is again white, because it is written in the guideline. Syringe with fixed needle, suture, surgical blade, and scalpel. These 4 things will go in white category. Rest all usual metallic implants like pacemaker or any orthopedic implant, they go in blue category, where we sterilize them by autoclaving and then we reuse them. Okay. Now, next question is about open vial policy. Probably this was the question, that A&M has to conduct vaccination camp in a village and she received 2 open vial. One is of pentavalent vaccine, one is of MR. What should be done next? So in open vial policy, as you must be knowing, we are having 7 vaccines which we can use up to 4 weeks of opening the vial if they are stored at adequate temperature and if they are not kept inside water. Then we can use it up to 4 weeks even after opening the ampules. So what are those 7 vaccines which come under open vial policy? One is the hepatitis B, second is the OPV, third is IPV, fourth is pneumococcal conjugate vaccine, and fifth is all the vaccines with T. So all the vaccines with T means DPT, TT, DT, pentavalent. Okay. So, sorry for this, the screen is getting switched off, but yes, now it is there. So, this is the question, that A&M is in the vaccination camp. She get Penta and MR. What should be done next? So these are the 7 vaccines which follow open vial policy. 2 are IPV and PCV. 2 are hepatitis B and OPV. And then after this 4, we have the vaccines with T. TT, DPT, pentavalent or DT also. 7 vaccines are there which follow open vial policy. That means after opening they can be used up to 4 weeks. So out of these 7, in the question they ask about pentavalent and MMR. So we should not use MMR because MMR is a live vaccines. If after opening you will use it till 4 weeks, it can cause some anaphylactic reactions. So we should not apply open vial policy for MMR vaccines. Although OPV is also a live vaccine, but MMR is something which do not come under this open vial policy. Okay. So remember these 7 names: IPV, PCV, OPV, hepatitis B and all T vaccines. So according to this, we will use Penta and discard MR, because Penta comes under open vial policy but not MR. Now let's come to the next question. Money given to ASA and mother under JSY. And there were several options for that. So to decide the money being given, we divide it into 2 types of states. One is low performing states, one is high performing state. And again in low performing states, we have urban area and rural area. So let's say we are talking about rural area here and urban area here. And we are writing the money of, let's say, Usha here, because in urban area we don't have ASA, we have Usha. And in rural area we are writing, suppose, the money of ASA. So in low performing states, the mother will get 1400 rupees. In high performing states of rural area, mother will get half of 1400, 700. In urban area of low performing state, mother get 1000 rupees. And in high performing states, mother gets 600 rupees. Now, when it comes to Usha and ASA, very simple to remember. Usha gets 400 rupees and ASA get 600 rupees. Okay. So out of the option given here, you can see one option says 400 to mother, 600 to ASA. This is not possible. Mother always get money more than ASA or Usha. Mother do not get less money than ASA. So this is wrong option. Second is 600 to mother, 400 to ASA. We do not give 400 to ASA. We can give 400 to Usha, but not to ASA. ASA always gets 600. So this option is also ruled out. Now, if the third option were 1400 to mother and 600 to ASA, then that will be correct for low performing states, rural area. Okay. This table is again something which we have also drawn in our notes. And these are the 8 low performing state. We also call it as empowered action group or Bimaru states. And why we call it as low performing? Because they have high MMR and IMR. The mother and child death are very high in those states. Very easy to remember. One is Bihar, second is the brother of Bihar, Jharkhand. Then is MP and brother of MP, Chhattisgarh. Then we have UP, 5 are there. Then we have Assam, Odisha and Rajasthan. Total 8 states are there. For all these 8 states, this is the money which is given in rural area, and this is the money in urban area. Okay. So I hope you can get it correct. Now, this is again a new question. If you are a PHC officer in an earthquake prone zone, what is your job as MO in disaster management? MO means medical officer. What will you do? So give instruction over phone or radio. This is something which is being done. This is not wrong. And you have to give instruction to people over phone and radio. Simulation of the disaster and assessing response. This is something which is written in the park to be done. That you give training to the people that in the earthquake prone zone, if there is any shaking of the ground, how you should evacuate the room. Then second point is you should be in the center part of the room, away from pillars and walls of the room. Third is it's better to come out in the open. Fourth is if you are in a car, try to have your car away from building or away from any electric poles and other areas. So this is again this is some part which was new to me. It is something which I don't teach in the class, to how to behave in a seismic zone area. But in the park it has written, you can see it, that you have to hold, look at this point, hold family evacuation drill and ensure that the whole family knows what to do in case of earthquake. So this is something which medical officers should do before disaster. And during earthquake, they should give information to the people on radio, and people should hold the radio. But before the disaster, they should hold this mock drills, evacuation drill, and ensure that family member knows what to do. Okay. Now, but still during the earthquake, they have not written the word clearly that as a medical officer or as a doctor, you have to give information on radios and all. But practically, we do give information on radios during earthquakes. Okay. Of course, I have not given that information anytime, but that's the usual protocol. So, if they ask, what is your job as MO? The best answer will be simulation of the disaster and assessing response of people. Okay? This is the better answer, because in this way, you can prepare the person before disaster. Suppose they ask it during disaster, during earthquake. If they ask the word during earthquake and all, then during earthquake, you cannot give training to people. So then you have to give information over phone or radio. But if they are asking your role as medical officer, probably they are asking it before the disaster, what will you do as a medical officer? So you have to hold the simulation drill. That is the best answer. Public health education is okay, but the better thing is you make them do the drill, how to evacuate the house. And then fourth point is preparedness at PHC level by utilizing resources. So at PHC, we don't have much resources to fight with earthquake response, earthquake disaster. At PHC, we can maximum what we can do is We can keep those tetanus vaccines and dressing ready. We can arrange team of nurses and health workers who can help the people, or we can let's say arrange some system by which we can give information to people on radio and other things. But other than that, we don't have much resources. So the best thing is, as a MO, we should do the simulation drill and we should assess whether people are doing the evacuation drill completely or not, and whether they know what to do during disaster properly or not. Okay, because it is written in the PARC also, so that's the best answer. Now, next question. Most logical and cost-effective approach of controlling rabies in urban population. So, PARC has written this word that the best approach, and they have used the word cost-effective. The same word is given in the question, which is from the PARC, that most cost-effective approach for controlling rabies is removing stray dogs and vaccinating the dog population. Our target is to vaccinate 80% dog population. If we have vaccinated 80% dog population, then we can get a good control over rabies spread. And along with that, if we are also removing stray dogs, then these two components completely united together can help in getting very good control of rabies in urban area. And for urban area, in PARC, they have used this line that remove stray dog and vaccination of dog population at least 80%, around 80%. This is the most cost-effective approach. So that was a direct question from PARC. And the next question is that a study was conducted to see the relationship between green tea and its effect on diabetes. The risk ratio was 0.8. So if the risk ratio is 0.8, 0.8 means the risk ratio is less than 1. Less than 1 means it is talking about protective association, or protective association is also known as negative association. The sign is not negative, but it is calling about negative association. What does it mean? Protective or negative means if you increase green tea, then the diabetes will go down. And that's what the study is suggesting. So we can say that this option, green tea, reduces the risk of diabetes mellitus. This is correct. Let me explain it a bit better to you. When the relative risk is coming 0.8, it means that if we are measuring incidence means new case of diabetes among green tea user, and we are comparing it to incidence of diabetes among non-user of green tea. Those people who do not use green tea, those response we are comparing. Okay, incidence of diabetes among non-green tea user. So suppose you have 1,000 people in both the group. 1,000 people who are drinking green tea, 1,000 who are not. So out of 1,000 who are drinking green tea, 80 develop diabetes, and out of 1,000 who are not drinking green tea, let's say 100 develop. So if you do 80 by 100, it means 0.8. 0.8 means green tea is reducing the risk of diabetes by 20%. Reducing the risk of diabetes by 20%. You can see it. 80 people are developing it in the green tea group, 100 people are developing it in the non-green tea group. So we can say that there is 20% less cases in the green tea group. That means if you drink green tea, the new cases of chances of developing diabetes will reduce by 20%. And this is the way to read it. Suppose in a question they have written odds ratio 0.6. 0.6 means there is 40% reduction. Whatever they say in less than 1, we have to subtract that from 1 and we get that much percentage of reduction. So 0.6 means 40% reduction, 0.8 means 20% reduction, so on and so forth. Okay. So if they say relative risk 0.8, it means green tea reduces the risk of diabetes mellitus. Okay. Now, These are the questions which we had collected actually from our organization. Some of the students have discussed the recall session, and they have said these questions had came. And if you have any other question from PSM part which you like to say or which you like to ask, you can say it in the YouTube chat box that these are the questions which came, and I would like to give the answer. Plus, if you think that any response ABCD is, let's say, is not that accurate, then again you can let me know. This is again a page from my note that if relative risk is less than 1, it means negative or protective association. So in our question, the relative risk was 0.8, less than 1. So it means green tea is protecting from diabetes. Okay. So thank you so much. If you have any further question which you want to ask or put in the group, one thing you can do is you can ask the question directly on my WhatsApp number. Second thing you can do is you can ask it on the eGurukul app. And third thing you can do is you can mail me, and you can ask it personally to me at docashwani23@gmail.com. And it is DOC, not DOG, 23@gmail.com. So thank you so much. I am waiting for any question. If you have some other question other than these in PSM part and you want to ask it, you can post it in the group. So thank you so much for listening. I hope this would help you in your future exam. Hasta la vista. Dasvidania. Bye-bye. Okay, these were the question which came, and these were the answer. Bye-bye. Have a nice life. Bye-bye. Any other question if you want to ask, please post it. Okay. Okay. Chalo. So this ASA distribution is under JSY program, which is something which you should remember now. It was an open vial policy had this these vaccines under it: IPV, PCV, hepatitis B, OPV, TT, DPT, pentavalent, and DT. Okay. So we have to discard pentavalent, not MR. And in blue category we have the glasses. Even if it is contaminated with vaccines, we still put it under blue category. And then for urban CHC, remember these things, that it should be at 2.5 lakh. We have to have around 30 to 50 bed at urban CHC. But in metropolitan area, it should be 100 bed. And we have discussed all this point. Okay, metropolitan, it should be 100 bed. Okay. Now, these were the questions which came. Of course, out of these 3 questions were new. One is the seed and manure, which was new. Second was the, as a medical officer, what will you do in the seismic zone? And third was that, what will you do to prevent urban rabies? And I think that is quite obvious that for urban rabies, we have to do mass vaccination, and we have to do the removal of stray dogs from the streets. Okay. So thank you so much for discussion. Hasta la vista. Dasvidania. Bye-bye. Bye-bye. I